A lot of strange signs happen in our bodies when vitamin B12 is low. And in this video, I'm going to tell you everything you need to know about vitamin B12 deficiency. What are the signs and symptoms? Why does it happen? How can you prevent it? Who is at risk? Which medications can lead to vitamin B12 deficiency? What is the best form of treatment? What tests are necessary? What should you look for in these tests? I'm going to tell you everything about this. Well, let's start by talking about where we can find vitamin B12. Mainly in foods of animal origin. So milk, eggs, meats, especially red meat, seafood, and fish. These foods are rich in vitamin B12. So you might be thinking, oh, so does that mean vegans have a higher chance of having this deficiency? Exactly. One way this deficiency can happen is if you don't eat these foods. But that's not the only reason. You might even eat them. But the second way this deficiency can occur is if you don't absorb them properly. Vitamin B12, well, in order to absorb and get this vitamin from food, we need acid in the stomach, acid in the intestine, and as the years go by, we start to lose some of that ability to produce this acid, and this can lead to a vitamin B12 deficiency. That's why elderly people are also in the at-risk group. There was a study that looked at people over 65, and in that group, 20% had a deficiency, a lack of vitamin B12. See how important it is for us to pay attention to this? Also, in other situations, like with people who have had bariatric surgery and no longer have part of their stomach or intestine, sometimes the part responsible for producing acid has been removed. So people who have had bariatric surgery are also in the at-risk group. There's another situation due to an autoimmune issue where the body can't produce this acid. It doesn't produce intrinsic factor, which is necessary for absorption. A vitamin B12 in the intestine. This condition is called pernicious anemia or atrophic gastritis. And the third cause that can lead to vitamin B12 deficiency is that you need increased intake. And when does this happen? During pregnancy or breastfeeding. That's why many pregnant women take vitamin B12, since we know they're in the risk group, because their levels of this vitamin can be lower due to increased consumption. Now that you know the causes, it's easier to identify who's in the risk group and should be alert for this deficiency. Vegans who don't consume animal-based foods. Elderly people who may not produce the acid properly. Also, anyone who has had surgery, like bariatric surgery. Anyone with a disease? Autoimmune diseases, because they can be associated. So, thyroid diseases, like Hashimoto's thyroiditis, which is the most common form of hypothyroidism and can lead to autoimmune hypothyroidism. Graves' disease, the most common form of hyperthyroidism. Other diseases, like celiac disease or Crohn's disease. Why? People with an autoimmune disease are more likely to have a vitamin B12 deficiency because of atrophic gastritis, pernicious anemia, where the body can't produce this acid, the intrinsic factor, which is essential for vitamin B12 absorption, pregnant women because they need increased intake, people who drink a lot of alcohol are also in this risk group, people who use certain medications, and this one is very common, especially among diabetics, which is metformin. Medications that interfere with stomach acid production, like omeprazole, pantoprazole, esomeprazole, ranitidine, and cimetidine. I don't want you to stop taking any medication. I'm just mentioning this so you can talk to your doctor. So they can order a vitamin B12 test because you're in a risk group. If it's well indicated. For example, metformin, it can be really good for your health, but we also need to pay attention to the side effects, okay? That's why I'm leaving this note here. So what are the strange signs and symptoms of this deficiency? Because a lot of times, for example, when you have heart palpitations, you go to the cardiologist because, oh, my heart, I think something's wrong with it. When you have a skin issue, you go to the dermatologist, like, oh, my skin isn't doing well. But when your vitamin B12 is low, a lot of times you end up suffering with these signs and symptoms because they're not as obvious as the examples I just mentioned. All right, sign number 1, changes in memory, forgetfulness. In fact, if a vitamin B12 deficiency isn't treated, it can lead to dementia. See how important this video is? It's one of the reversible causes of dementia. Can you actually get better from this? If the cause, which is the lack of this vitamin, is corrected. By the way, if you forgot to like this video, that could be a sign your vitamin B12 is low. So go ahead and hit that like button. Let's set a goal of 10,000 likes. Jokes aside, forgetfulness really is one of the signs and symptoms of low vitamin B12. The second sign that your vitamin B12 might be low is the signs and symptoms of anemia, because we need vitamin B12 for our bone marrow to be able to produce red blood cells. So what are these signs and symptoms? Tiredness, fatigue, waking up already feeling exhausted, paleness, and in more severe cases, even heart failure and shortness of breath. For example, you used to be able to climb a flight of stairs, but now you go up and you're already out of breath. You used to be able to walk to work, for instance, but now, with the same effort, you feel like your physical capacity is decreased. So it's really important to pay attention to this because it could be a sign of vitamin B12 deficiency. Well, since we've already mentioned 2 signs and symptoms, are you starting to see what vitamin B12 does in our bodies? There are 2 main things. The first is our central nervous system, like with memory, for example. Vitamin B12 is involved in the myelination of our neurons. It's essential for that. What does that mean? It's the sheath that covers the neurons. So for the signal to be strong, we need this vitamin for proper communication between neurons. See how important that is? And the second major function is exactly in the production of red blood cells, because the body uses it as a substrate, as a source to be able to produce more red blood cells. So when there's a deficiency or lack of vitamin B12, we can develop anemia. And this anemia has a specific characteristic. This type of anemia happens when the red blood cells are larger, which we call megaloblastic anemia. Have you ever seen a blood count test? You might have noticed that there are a lot of abbreviations. One of those abbreviations is MCV, mean corpuscular volume, which measures the size of these cells. What is the normal size of these cells? Between 80 and 100. In vitamin B12 deficiency, this value can go up. So 110, 120, for example, that means the red blood cells are enlarged, and that's one of the clues for vitamin B12 deficiency. Hey, have you always been curious about those abbreviations? A lot of people ask why there are so many little numbers, so many letters too. So one of these clues is because it can indicate a lack of vitamin B12. Other situations can also lead to this increase, like folic acid deficiency. That can also cause what's called megaloblastic anemia. By the way, the most common type of anemia is caused by iron deficiency, and iron deficiency is the opposite. It causes the red blood cells to get smaller. So a volume lower than 80, called microcytosis, is when the red blood cells are small. Let's keep going here after that explanation. I hope you liked it. But the third sign is tingling, or in medical terms, what's called paresthesia. So tingling, decreased sensation in your legs and your arms. Do you feel like you have ants crawling on you? On your feet, for example? That could be a sign of vitamin B12 deficiency, because as you saw, it plays a role in forming the coating around neurons, the myelin. So if you're lacking vitamin B12, a process called demyelination of the neurons can happen. And one of the signs and symptoms is that you might feel tingling in your legs and feet. You guys ask a lot, my legs are tingling, what could it be? So one of the causes we need to check is whether you're lacking vitamin B12. The fourth sign, mood changes. You also saw that it plays a role in our central nervous system. So people with this deficiency have a higher chance of developing depression, for example. So that's something that always needs to be checked as well. Sign number 5 is hair loss. Vitamin B12 deficiency can also cause hair loss. Sign number 6, changes in balance. Vitamin B12 is essential for what we call proprioception. And when it's low, you might feel dizzy, you might lose your balance, or even have trouble walking. So whenever a patient says, "Oh, I'm feeling off balance, I'm feeling dizzy, I'm having trouble walking, sometimes even running," so a vitamin B12 deficiency can cause balance problems. And sign number 7 is that vitamin B12 can also affect your vision. I included this sign here because it increases the risk of a condition called age-related macular degeneration. So it's also essential to check your vitamin B12 levels. And we know that this vision problem increases with age, just like vitamin B12 deficiency does. In the group of people over 65, 20%, look at that, 20% is a very significant number, could be lacking vitamin B12. That's 1 in every 5 people. So this video is really important. Well, what tests should you do? How do you check for this? Ideally, you shouldn't have these signs and symptoms, and your doctor should catch it before you get to that point. So how can your doctor do that? There are 2 tests that can show changes even before your vitamin B12 starts to drop. These are early markers, homocysteine and also methylmalonic acid. That said, how do we actually assess the deficiency itself? By checking your B12 levels, so by directly measuring it in your blood. We've seen that vitamin B12 can affect your blood count and these markers, but other deficiencies can also show up at the same time, like folic acid deficiency, vitamin B6 deficiency, and also iron deficiency. Vitamin B6 is harder to measure, but whenever we suspect this deficiency, B12 in cases of anemia, for example, iron and folic acid also need to be measured to assess this issue, especially because patients often have multiple deficiencies at the same time. And if you only take vitamin B12 supplements, you could actually make these symptoms worse, which is something I see pretty often. The patient has low levels, starts supplementation, but has other deficiencies as well, so their symptoms end up getting worse. And how's the treatment done? Well, that'll depend on the cause. Preferably, the treatment is done orally. In cases where the person can't absorb it because they don't produce acid properly, other forms like intramuscular injections can also be used. The dosage varies a lot. I know you're going to ask, but it really depends on each person. There's a really wide range, and I can't give a single dosage here for everyone. That's why it's important to consult a doctor. From 0 to 10, what score would you give this video? If it's a 10, I'll make more videos like this one. Let me know in the comments where in the world you're watching this video from. Which city? I'm speaking from Porto Alegre. Now that you already know about vitamin B12, there's another vitamin that's really important and that a lot of people are also deficient in, vitamin D. You want to know more about it? What are the benefits and the risks? Then click here and you'll be taken to that video. I'm sure you'll like it. Take care. See you next time.